A 20-year-old boy requires a urethral catheter to be inserted prior to undergoing a splenectomy. Where is the first site of resistance to be encountered on inserting the catheter? Internal sphincter, prostatic urethra, bulbar urethra, membranous urethra, bladder neck. The answer would be membranous urethra. The membranous urethra is the least distensible portion of the urethra. This is due to the fact that it is surrounded by the external sphincter. Now we will talk very shortly regarding the urethral anatomy. Female urethra. The female urethra is shorter and more acutely angulated than the male urethra. It is an extraperitoneal structure and is embedded in the endopelvic fossa. The neck of the bladder is subjected to transmitted intra-abdominal pressure, and therefore deficiency in this area may result in stress urinary incontinence in female. Between the layers of urogenital diaphragm, the female urethra is surrounded by external urethral sphincter. This is innervated by the pudendal nerve. It ultimately lies anterior to the vaginal orifice. The male urethra is much longer and is divided into 4 parts. Pre-prostatic urethra, extremely short and lies between the bladder and the prostate gland. It has stellate lumen and is between 1 to 1.5 cm long, innervated by sympathetic noradrenergic fibers. As this region is composed of striated muscle bundle, they may contract and prevent retrograde ejaculation. Prostatic urethra. This segment is wider than the membranous urethra and contains several openings for the transmission of semen at the midpoint of the urethral crest. Membranous urethra, narrowest part of the urethra and surrounded by external sphincter, traverses the perineal membrane 2.5 cm posterior inferior to the symphysis pubis. Penile urethra. Travels through the corpus spongiosum on the underside of the penis. It is the longest urethral segment. It is dilated at its origin as the infrabulbar fossa and again in the glans penis as the navicular fossa. The bulbourethral glands open into spongy part of the urethra 2.5 cm below the perineal membrane. The urothelium is transitional in nature near the bladder and it becomes squamous more distally. If the video was helpful, please hit the subscribe button and like our videos.